My name is Alan Cohen. I've been a GP about 25 years and I currently work as the primary care advisor for the National Institute of Mental Health in England. Stress is how the body reacts to external pressures that we perceive to be difficult, uncomfortable, and it creates both physical changes in the body, so sweating or worry or frustration or anger. Talking to you today, stress is not a problem. It's good for me. It makes me perform better and more effectively. Stress becomes a problem when instead of helping me perform, it actually becomes counterproductive and I go terribly tongue-tied and can't think of what to say. That's when it becomes unhelpful. And when that lasts for a long time, we get chronic stress, then people become really quite unwell. And the difficulty is knowing for an individual when they should seek help, when stress has stopped being good and started being bad for them. Stress can affect anybody, it can affect you, it can affect me. And what's interesting that what may be stressful for you may not affect me very much, and vice versa. So it's very much an individual perception, a meeting of the individual personality with an external event. So the common causes of stress are things, pressures at work, for example, pressures at home, pressures around money, pressures around employment, especially nowadays, are all things that commonly cause symptoms of stress. When stress becomes bad for you, the commonest sort of feelings that one gets inside oneself is one of either anxiety and depression, that you feel unable to manage things, unable to think clearly, everything becomes an effort, you're slowed up, you can't think clearly, as well as feeling on edge, unable to concentrate, tearful, a whole variety of these uncomfortable emotions. Often these are associated with physical symptoms as well. So we might get headaches, might get tummy ache, might get backache, and one can describe these as being linked to the mental health problem because of the way the body works. It doesn't separate mind and body. We work together as a single unit. And in the same way that the emotions get disturbed, so the way the body works gets disturbed. As a GP, I see lots of people with a whole variety of symptoms, a whole variety of things that they come and present to me, some of which are psychological, some of which are physical. And it's the skill of the GP that they need to disentangle what's going on to work out whether the abdominal pain and the sweating is due to an underlying physical cause like an ulcer, or whether there's something going on at work or at home that's upsetting them. And how you identify that depends on the ability to listen to the patient, to understand what the symptoms mean to the patient, to listen to what their possible explanations are. It's about good conversation between the doctor and the patient, and both being honest with the other.